Hello everyone, my name is Sherifat Absalam. I'm here today to perform drawing up insulin. First, I'm going to verify the physician order that it aligns with the medication rights, which is to have the right patient, the right drug, the right dose, the right route, the right time, and the right documentation. Once I've done that, I'm going to take the order and compare it with the EHR to confirm it's properly transcribed. The order states to administer regular insulin 4 units, intermediate NPH insulin 8 units subcutaneously every morning before breakfast to the patient. Once I confirm with the EHR that the order is properly transcribed, and then I'm going to gather my equipment and go into the patient's room, knock knock, provide privacy, identify the patient 2 ways, confirm that with the wristband. If there are people in the room at this point, I'm going to ask if the patient want people in the room with them. If the patient says no, I'll excuse the people. Although this is because of HIPAA protection. Once I've done that, I'm going to ask the patient if they have any known medication, food, or seasonal allergies. If the patient says they don't have any allergy, then I'll proceed by performing hand hygiene and wearing my gloves. While I'm doing this, I'm going to also have a second staff around me, because when you're drawing up insulin, you want to have a second licensed staff around you to verify the order. Once I've done that, I'm going to explain the procedure to the patient, let them know the doctor has ordered insulin to be administered to them. Insulin works by regulating blood glucose in the body, and it's usually used to manage diabetes in diabetic patients. Some of the common side effects are hypoglycemia, which include blurry vision, some sweating, some injection site irritation. They could also experience some rash. More adverse effects could be having some rapid weight gain, some edema, localized or pitting edema, and then some tachycardia. I'll ask the patient if I'll let the patient also know that during administration, some people have complained about stinging and burning around the injection site. This is common. However, if they are not comfortable with it, they should let the staff know. At this point, I'm going to also let the patient know that normal blood glucose level for patients receiving insulin is usually between 80 to 130 mg per dl, and that because this insulin is rapid acting, the onset is 30 minutes. They will have to be given breakfast 30 minutes after administration. At this point, I'm going to then start ask the patient if they have any question. If they don't have any question, then I'll start drawing up the insulin. As mentioned, another staff is with me. So first thing I'm going to do is also to do the blood glucose check for the patient, and then record the findings. At this point, the blood glucose for the patient is 110 mg per dl. I'm going to record that. If there is a sliding scale for normal for the insulin blood glucose that will be administered, I will use that. But specifically for this purpose, the order is to administer 4 units regular, 8 units subcutaneous every morning before breakfast. 8 units NPH subcutaneous every morning before breakfast. So I start the process of drawing up the insulin. I'm going to use the alcohol swab. Prior to this, I'm going to also check the EHR MAR again with the nurse to take out the medication. We have the NPH, and then we have the regular med taken out. I'm going to clean the top of the vial, and then I'm also going to roll the medication gently in between my palm, because it's always straight from the refrigerator and we want to keep it back to room temperature. Once that is done, and then bringing out the insulin, normal insulin once opened, it's always labeled to be used within 28 days. We've also confirmed that that has not expired, so we have a valid medication in front of us. For my supply, I have the insulin unit, which already comes in unit. I have the 29 gram by 0.5 inches to be used. So because I have a clear insulin and I have a cloudy insulin, I have to draw from clear to cloudy. Because of that, I have to draw up the 8 units of hair to put into the cloudy, which is the NPH, before drawing up from the regular, so that we don't mix while I've taken out from the regular. I can't pump hair again into the NPH. So at this point, I'm going to pull back the plunger to draw out 8 units of hair. 8 units of hair, and then I'm going to push that hair into the regular into the NPH without touching the medication. So once that is done, I'm going to now pull back 4 units of hair into the regular. Hold like a pencil, push down, push the hair, oopsie, and flip over. I'm holding the vial by the neck because I have a very thin needle. I don't want it to bend, and then I'm going to hold it. At this point, I've mentioned that I've recorded the blood glucose check that I had of 110 with the nurse verifying it. Then I'm going to gently draw up 4 units of the regular. 4 units regular, gently lift the vial up, put it down. If there is any bubble at this point, I'm going to fill. If there is more bubble, I'm going to tap at the bottom for the bubble to go out. Verify this with the second nurse with me. I have 4 units of regular insulin drawn up. Then I'm going to now draw up from the NPH insulin, the cloudy one. Like I said, we're not pushing anything. I'm just putting the needle, and immediately I'm going to flip over to draw because I'm not putting any hair. Yeah. For the 4 unit that was done, we've already recorded that and signed off on it. At this point that I'm going to draw up the 8 unit, everything will now total to 12 units. This one I'm going to draw gently because I don't want to draw up too much. So I don't have too much that I'll have to now need to push back in to get the hair. Gently take out the vial, place down. Have the second nurse verify that. In total, I have 12 units. That is 4 units regular, 8 units of NPH intermediate, to have a total of 12 units. 1 hand scoop. One hand scoop. Okay. Once that is done, we'll do our final verification to make sure we have the medication. Go back to the EHR mark, compare, and make sure we have a total of 12 units, which is 4 units regular, 8 units NPH, to have a total of 12 units. Because the patient is not with me, I'm going to label this already filled syringe with the patient's name and the patient and the dosage there, and then I can go to the patient's room for administration. Thank you.